You're doing well. HIV is on the decline. Mother-to-child transmission of HIV is on the decline. Malaria is on the decline. I know the malaria elimination, of course, some hiccups, but it's now on the decline again, and there is the joint South Africa elimination effort. On many of the partnerships we have, there is progress, and also during my visit, we'll see the challenges and to strengthen further our partnership.
The World Health Organization wants to ensure that its members, including Namibia, are not caught off guard by another pandemic. The lessons learned from the COVID-19 pandemic, WHO says, is therefore guiding it to develop strategic interventions, including access to vaccines and other treatments. President Geingob put up a fierce opposition when African countries were considered last to receive the COVID-19 vaccines. This was even after the countries had paid upfront for the batches, leading to the president labeling it as vaccine apartheid.
And of course, you're coming in with a little bit. We waited, although we paid, and we said we are left out. Some friends came, India and China came before our own paid vaccines came. So that's a terrible period. It really taught us that we are one in this world. There was no discrimination, no rich country, no poor, no black, white. We all suffered equally. And I hope that what we have taught us, it's a one world we are living in. I will try to coin the concept of one Namibia, one nation, one Africa, one continent, one world, one village, global village. And that's how we have to look at the world. We are one. And that thing taught us that nobody is immune from these things.
Namibia's outcry, the WHO chief says, encouraged the world body to continue emphasizing the need for equality in healthcare.
And I would, of course, I came to see you because to also thank you in person for all the support you have given me, especially during the difficult times in the middle of the COVID, especially at the height of the COVID pandemic. We know the pressure, especially on WHO at that time, and you're one of the leaders who stood and supported, and that helped us to get energy and inspiration.
The WHO is now working towards local production through the establishment of the mRNA Technology Transfer Hub facility set up in South Africa. So far, about 15 African countries have signed up to be part of the facility. Blanche Koreses, NBC News.